Hello, my name is Catherine Turner. My pronouns are she, her, L-A-A, and I'm here to present to you an introduction to abortion values clarification and attitude transformation, transforming abortion care attitudes and actions. Again, I'm Catherine Turner, and I'm president of Global Citizen LLC consulting firm and an adjunct professor at the University of North Carolina, Chapel Hill in the United States. I'm also the abortion vcat framework, toolkit, and evaluation author. You see here my education credentials, and at Global Citizen LLC, our mission and passion is collaborating with other consultants and leaders across all sectors to develop inclusive leadership and affect organizational transformation and social impact by advancing diversity, equity, and inclusion, public health, human rights, and global competence for a better world. In today's presentation, I'll be talking about what is abortion values clarification and attitude transformation, or vcat, as well as values clarification. Why do we do it? And give some examples of some abortion vcat activities, as well as evidence and testimonials. And I'll describe the vcat toolkit and related resources. I'll provide a few facilitation tips and discuss how to integrate vcat into your programs. First of all, whenever we're going to be leading an abortion vcat training or workshop, it's important to put group agreements in place. And the group agreements are basically a set of agreements that participants and facilitators agree upon in order to create a conducive environment in which everyone feels comfortable to fully and authentically participate. These are a set of group agreements that Global Citizen uses for our workshops, and you can feel free to create your own or co-create them with your participants. And again, they are important to put in place from the beginning to ensure that participants and facilitators agree to them, and then that you maintain them throughout the workshop. So when we think about what is abortion vcat, it's led by trained facilitators, and it's a process that's conducted in a safe environment with diverse stakeholders that really allows people to examine their personal values, their attitudes, and their actions, and engage in honest and open-minded critical reflection, and really deeply understand the harmful consequences of stigmatizing abortion and restricting access to care, and most of all, to uphold women's right to high quality, safe abortion care. Abortion vcat as a methodology is designed to help participants challenge their deeply held assumptions and myths. We know that there are many campaigns to spread misinformation about abortion globally, and therefore many of us grew up with incorrect information upon which we founded our beliefs and values about abortion. So it's important to provide factually correct information about abortion, and also to provide people with realistic scenarios about the reality of abortion needs and care in their settings. It's also a setting in which people can really explore their deeply held values and really think about their values in a very intentional way in relation to realistic abortion scenarios. And this can often lead people to potentially resolve their values conflicts. It also has the capacity to potentially transform people's understanding and beliefs and attitudes about abortion that impact their behaviors, as well as to state their intentions to act in accordance with their affirmed values. So abortion vcat is values clarification, plus with the potential of transforming attitudes on abortion. When we think about what is values clarification, it's both a theory and an intervention. So we need to understand the values theories and values clarification, which originated in the humanistic psychology and education fields. Values clarification is both a theory and an intervention that was inspired by thinkers such as Abraham Maslow and Carl Rogers, who believed that people are responsible for discovering their values through the process of honest, open-minded self-evaluation, examination, and a search for life's truths. Values are closely related to and affected by our beliefs, ideals, and knowledge, and they affect our attitudes and behaviors. Values serve as our internal roadmap. They play a key and enduring role in the decisions that we make, what we spend our time and energy on, and how we act. According to Milton Rokeach, values clarification is the process of examining one's basic values and moral reasoning. Steele added that values clarification is done to understand oneself, to discover what is important and meaningful. One of my favorite quotes about values clarification is by John Dewey, who talked about valuing occurs when the head and the heart unite in the direction of action. It's important to understand the theories and evidence that form the foundation of the vcat process and methodology. The vcat theoretical framework is a conceptualization of the process and intended outcomes of abortion vcat that incorporate the critical elements of values theories, the values clarification process, and the theory of planned behavior. The vcat theoretical framework was conceptualized by myself and Kimberly Chapman Page to inform the development and organization of the IPASS Values Clarification Toolkit, and it serves as a reference when we're designing abortion vcat interventions. So I highly recommend that for anyone who's planning to design and facilitate an abortion vcat workshop or training, that you really use the framework as a guide to think through all the aspects of your design and ensure that you're really taking participants through this process. And I'll describe the process in a little more detail now. So one is that people need to come in with a motivation to change or an openness, and that's important. I've been in situations where people came in with very closed minds and said that they really weren't going to participate, they really weren't going to be open and open to new ideas. And when that is the situation, vcat is not going to be effective. But most people come in with an openness to learning. And so we take people through this process of gaining knowledge. And again, we want to ensure that they're learning factually correct information about abortion, and then deepening their understanding by providing more context. We want them to experience empathy. So we're going to design activities that are designed to evoke people's empathy around women and girls who seek abortion and all the reasons for that. We want people to acknowledge their current values and then examine alternative values by contrast, and then to recognize barriers to change and remain open to change. And all of this process is kind of feeding into the values clarification process, in which people undergo this process making an informed choice about their values, affirming their values, and then taking action that are congruent with their values. And this all encompasses the values clarification process. Then we theorize that the VC process leads people to an attitude transformation. And we were able to show that this did in fact occur in the study, the evaluation study that I'll be describing a little bit later. So once people have undergone an attitude transformation, they also are forming behavioral intentions about how they intend to act in congruence with their affirmed values and their transformed attitudes. And this then leads to behavior change. And so these are consistent with their affirmed values. So this is really, again, the theoretical underpinnings of the abortion vcat process. This process was also described in a similar way using the IPASS and Turner and Chapman Page framework by Marie Stopes International, as is described in this infographic. I'm going to be describing a couple of vcat activities, and the first one is called facilitating dialogue. And I often will facilitate this activity towards the beginning, at the very beginning of a workshop, in order to really help ground the conversation in the local context. So I'll begin with a story that again would be a story from the media or from an actual local clinic or community, or it could be an image that's used, or it could even be a skit that's performed by workshop participants. And so people will hear the story being read or see the skit being performed, and then the facilitator will take them through a series of questions. And the story or the skit or the newspaper or media narrative will be describing a situation that's happening in their context, and that is describing the kinds of dilemmas and difficulties that women and girls go through when they are experiencing an unwanted pregnancy, when in many cases, because of lack of access to safe abortion care, they might undergo an unsafe abortion and then come to a clinical setting or be discovered by someone in a state of emergency. And so many healthcare providers around the world had been in that unfortunate situation of having to receive a woman or girl who's coming in with some extreme complications of unsafe abortion. And so we'll describe this situation, and then we'll take participants through a series of questions, such as, what did you hear or see happening in this story? How does this story reflect what you are experiencing in your setting? And then how does this relate to our work, our lives? What do we need in order to be able to do about situations like this? And what will we do? So it takes people through this process of root cause analysis, of really understanding the root causes of unsafe abortion or lack of abortion access in their setting. And then through this brainstorming around what it is that they need to have and to be able to do in order to take action and resolve these types of unfortunate and preventable situations. So when we talk about why we do vcat, what I just described in terms of this type of scenario and story really ties into this question: why do we implement abortion vcat? And so one reason is I wanted to share a story from an OBGYN, an obstetrician gynecologist who was practicing in Lusaka, Zambia, who I had the pleasure of collaborating with. And while she's now an advocate for women's comprehensive right to comprehensive abortion care, it wasn't always that way for her. When she was growing up, she learned that abortion was wrong, it was a sin, and she had very negative views on abortion. When she was training as an obstetrician gynecologist and she was asked to perform post-abortion care or uterine evacuation for women coming in with complications of incomplete abortion, she had very negative views on abortion. And so with great regret, she recalls how previously, when women would come in and she was to perform a uterine evacuation, she would deliberately withhold pain medication from them. In fact, she felt at the time that she wanted them to feel pain. And she said, quote, "I used to do it because the uterine evacuation, because it was part of my job. I was one of those people who wouldn't give pain relief. I used to think, okay, those who had induced abortions serves them right. Let them feel the pain. Maybe next time they won't have an abortion. Maybe next time they'll be more careful. I was that kind of doctor." And so again, with deep regret, she thinks back on that time when she really provided, was mistreated many of her patients. And that now, having undergone the abortion vcat process and having become not only a provider of comprehensive abortion care, but an advocate for women's right to safe abortion care and comprehensive abortion care, she really gave very powerful testimonial to the power of abortion vcat in addition to appropriate clinical training. So when we, again, are talking about why do we implement abortion vcat, we know that women are forced to resort to unsafe abortion because they lack appropriate access to contraception and to safe abortion care. And there are many reasons why contraception and abortion care are not offered, including stigma. And there are so many stakeholders who have a role to play in restricting women's access to safe abortion care. And these can include policymakers and government officials and health system officials, healthcare providers and lawyers and community leaders, and so many other stakeholders. And we know that abortion stigma is a social phenomenon that's really rooted in values, beliefs, and biases that are then perpetuated by these political, economic, and social systems and generated and experienced at both the personal and societal levels. And this has been explored through a number of different research studies and articles. And so we know that we need to address the root causes of abortion stigma in order to positively impact barriers to abortion care and provision. And so vcat interventions engage stakeholders to really identify and address stigma-related barriers to abortion service provision, access, and quality of care that are stemming from misinformation, perceived values, conflicts, negative attitudes towards abortion, like I was just describing, a lack of empathy and professional and personal responsibility, as well as a lack of respect for women's rights. And so abortion vcat workshops are designed to address these root and stigma related causes to restricting access to abortion care. So again, we do vcat to help people resolve their values conflicts, which is where people are holding these seemingly conflicting or incompatible belief systems, and that they are then being asked to act in ways as healthcare providers that may feel in conflict with their values or with their declared beliefs. But oftentimes people are basing these beliefs on incorrect information and misinformation and myths. And that can really lead to this deep sense of discomfort, as well as negative attitudes towards their duties and patients, like I just described, as well as the lack of clinical confidence. I certainly have worked with many nurses and doctors who were very nervous about providing abortion care initially, either because of a perceived values conflict or because of not feeling clinically competent. And so we know that it's important to pair effective clinical training with abortion vcat in order to address all of these different barriers to service provision. So there are a number of different organizations, including the World Health Organization, that have really endorsed the importance of abortion vcat in conjunction with clinical training. And the WHO first endorsed values clarification in their first and second editions of Safe Abortion, Technical and Policy Guidance for Health Systems, as well as in their 2022 Abortion Care Guideline. So we know that clinical skills are vital, but not sufficient to ensure that providers are delivering safe and appropriate care, and that providers need clinical skills training to be able to perform a uterine evacuation safely, but then they also need this kind of training on values clarification that can really help them develop a deep respect for women, as well as a deep understanding of their own role in abortion care. And we know that the WHO has quoted here in 2022 that common barriers to the implementation of abortion care included stigma and the role of social norms and values, and that to ensure an enabling environment, it's particularly important that training for health workers involved with sexual and reproductive health services incorporates values clarification. As well as when it comes to abortion counseling, it's essential to apply the following guiding principles: that counselors or providers will present all suitable options tailored to one's individual needs while avoiding imposing one's personal values and beliefs onto them. And providers are humans first and may not know how to do this. And so really will benefit from values clarification training in order to know how to separate their own beliefs and values from those of their clients or patients, as well as how to provide high quality care that is respectful of women's rights. So in addition to providing values clarification, attitude transformation on abortion, with different stakeholders, so in addition to providing it with healthcare providers, abortion vcat can also be provided to different stakeholders, including government officials and policymakers, or those who affect policy change and laws, as well as community members and police and other law enforcement, who are often the first responders on a scene when there has been an unsafe abortion, as well as lawyers and media professionals, those who provide funding to programming around sexual reproductive health. Faith leaders are a particularly important group, as well as different advocacy coalitions and others. I'm now going to describe another vcat activity called Comfort Continuum, which is where, again, towards the beginning of a workshop, it can be helpful to facilitate this activity because it can help both participants as well as facilitators really get a solid sense of where participants are at in terms of their current knowledge and comfort levels. So participants are asked a series of questions and then asked to place themselves along a continuum around either from one end being not at all to the other end being completely. When they're asked about how knowledgeable they are about abortion laws or how comfortable they are with abortion being provided according to laws and policies in their setting, or how comfortable they are discussing abortion with their colleagues or with their family members. And as each person places themselves along the continuum, the facilitator will ask a couple of people to share why they placed themselves where they did. And that just helps that person and as well as other people through hearing them describe their reasoning. It can help them also clarify where they are, their present state when it comes to their knowledge and attitudes and comfort levels with abortion. And this is really helpful at the beginning of a workshop to help the facilitators understand where they may need to focus their attention during the workshop. Another vcat activity is called Reasons Why, and this really helps participants really understand a lot more of the complex context around abortion and unwanted pregnancy, and all of the reasons why women and girls may engage in sex, may find themselves with having an unwanted pregnancy and might engage in, and might seek an abortion. Because oftentimes we can be somewhat limited in our understanding of all the different context that people live in. And so by having this brainstorming session and really thinking through very outside of the box what all the reasons are, it can help providers have more empathy and more understanding for girls and women who are coming to them for care instead of making assumptions about why a woman might have had sex, why she might have an unwanted pregnancy, and why she may be seeking abortion. So in the beginning, I talked a little about the evidence to support abortion vcat methodologies and implementation, and there is substantial published and unpublished evidence to support abortion vcat methods and results. So one of those is an article that I published with my colleagues in 2018 in the journal Reproductive Health that's titled Values Clarification Workshops to Improve Abortion Knowledge, Attitudes, and Intentions, a pre-post assessment in 12 countries. And while I have conducted literally hundreds of abortion vcat workshops and training of trainers around the world, and we did evaluate many of those, we were very rigorous in our methodology of only selecting those workshops for which we had paired pre-post assessments, and then analyze those assessments from 43 workshops conducted in 12 countries, in which we were looking for changes in knowledge, attitudes, and behavioral intentions. And what we saw was that overall, there was a statistically significant increase in participants' knowledge on abortion, on their positive attitudes towards abortion, and towards their behavioral intentions to either provide or assist with, if they weren't providers, safe abortion care. And interestingly, what we also found is that those who started out with the most negative, the least amount of information or the most negative attitudes experienced the most significant gains. And so this really helped to provide more of a grounding of evidence to support the implementation of abortion vcat. Certain country programs have also published their both process and results in implementing abortion vcat, and this is an example of a publication that my colleagues in Pakistan and I developed to really describe the process that they went through in implementing abortion vcat in country, as well as their results. And there are a number of testimonials, many testimonials from participants of vcat workshops over the years. And this was Dr. Nusrat Shah in Pakistan, who talked about her experience with complications of unsafe abortion dates back to the early days when she was in training. And while they were taught about different ways of evacuating the uterus for spontaneous abortion, induced abortion care was not discussed in her medical training. And so she went through a number of different clinical trainings to learn how to provide uterine evacuation. But it wasn't until IPAS went to Pakistan and provided abortion vcat workshops that she really started to do some internal reckoning around her beliefs and values and her responsibilities as an OBGYN. And it was through taking part in different vcat activities and workshops that she was thoroughly sensitized, in her words, and convinced that it was not enough to just refer women to safe services. She felt that providers must share the responsibility of providing the service ourselves if we truly want to reduce maternal mortality and morbidity. And then another testimonial from an obstetrician gynecologist in Nicaragua said that he came to the IPAS vcat workshop with a lot of distrust and fear and doubts about what this workshop would be about. He said he grew up in a family with strong Christian values and moral principles, and he really had grown up to believe that abortion was sinful. But then this workshop really helped him to see abortion care in a different light, and that he understood more of the context surrounding the reasons why women seek unsafe abortion and the kinds of dangers that women's lives and health are placed in based on the lack of access to care. And then he really then started providing more support to women who were seeking abortion services with real humanity and ethics and professionalism, in order to contribute to the construction of a society that is respectful of women's rights, in his words. So we have a number of resources on abortion vcat. There is a toolkit in English, in Spanish, in French, as well as for humanitarian audiences, adapted for young women. And some of my colleagues at IPAS, where I had worked at formerly, had developed the stigmatizing attitudes, beliefs, and action scale as well. And all of these resources are available on IPAS's website. So in talking about how to integrate abortion vcat into your programs, it's really important that you first clarify what are our objectives and how can abortion vcat help us achieve our objectives. And then using that theoretical framework that I talked about earlier to select the appropriate activities and to really use the framework as a guide for the design, and then carefully selecting your trainees and your trainers. And then it's often helpful to, again, really adapt the content to the local context, to really pull out a lot of local stories about what people are what women and providers are facing, and lawmakers are facing in terms of abortion in that context, and to really make it very relevant and locally relevant. And also, I highly recommend conducting an evaluation in which you have implemented a pre and post and follow-up survey to evaluate the results. And there are examples of these surveys in the IPAS vcat toolkit. So just to give an example of how one country program in Ghana integrated vcat into every aspect of their comprehensive abortion care program. So beginning with the strategic assessment that was conducted with the World Health Organization, and then this initial workshop that I facilitated with key stakeholders across the country when we were developing the national clinical standards and guidelines to provide the guidelines for how providers would offer safe abortion care, when we conducted meetings and trainings with the Ministry of Health and at the national and regional levels and local facility levels, when we conducted trainings of trainers, as well as whole site orientations and provider clinical trainings, as well as trainings for youth advocates and community leaders, as well as police and lawyer. We integrated abortion vcat into all of these aspects of the program, which really helped contribute to a very successful national comprehensive abortion care program in which people were and still are providing abortion care fully, and women have much greater access to comprehensive abortion care across the country. I promised a few vcat facilitation tips. One is an apprenticeship training model where it really is a very complex process to facilitate abortion vcat, and if done badly, it could actually potentially cause harm. So I really recommend that only very trained facilitators lead abortion vcat, and that those who are learning will first observe. They might participate as participants and then observe as trainers in training. Then they might co-facilitate with a more seasoned facilitator, and then ultimately facilitate themselves with the more experienced trainer, observing and providing them feedback in private, so that there's this process for them to go through to learn how to facilitate well. Another point is that VCAT is not the same as advocating. And so we want to create an environment in which people can really be honest about their true beliefs and values and feelings about abortion, so that they can feel comfortable undergoing that whole reflection and self-examination process. So it's important that they don't feel like they're coming in and we're trying to change them. We're not trying to change their values. We're trying to create an environment for them to be able to explore and to clarify their values, and then to align their actions with their clarified values. I also find it helpful to facilitate some level of mindfulness practice for people to be really in tune with what their thoughts and feelings are, and what they're feeling in their bodies, that can provide a lot of helpful and useful knowledge for them as they're doing this exploration. It's really important to ensure emotional safety, and to really monitor kind of participants' responses, to have co-facilitators who are available if you can tell by someone's expression that they're experiencing discomfort. Sometimes participants can experience flashbacks or memories of what has happened to them in the past, and may need some support for that. Also, language. Oftentimes, these are such complex conversations that people are usually most comfortable holding them in their primary language. So you may need to consider what your participants' primary languages are, and ensure that you have facilitators who facilitate those conversations, and really to just embrace the discomfort, the uncertainty, and some of the messiness that this process can entail as people are going through this process of self-examination, and most of all, just to trust the process. So I and others have designed and facilitated trainings and workshops on values clarification and attitude transformation on other topics in addition to abortion. And these can include counseling and family planning or contraception, lesbian, gay, bisexual, transgender, plus health and rights, as well as disability inclusion. I've also facilitated them on global competence and cultural humility and immigration policies and practices, and many other topics where there is often a lot of disagreement. There might be social stigma around these topics, and where people really benefit from that opportunity to undergo some values clarification. So I just am grateful for this opportunity to review an introduction to abortion, values clarification, attitude transformation with you. Again, my name is Catherine Turner. It's been a real pleasure to be here to present with you. I welcome you to reach out to me and to Global Citizen. If we can be of service, we'll be happy to talk more about the services we provide in terms of consulting, coaching, and training and related services, and reach out to us at info@globalcitizenllc.com, or our website, globalcitizenllc.com, as well as social media. Thank you so much.